या video health education ni chapter gatham pa drugs medicines and self medication ko nyang khanamo daude drugs ni orthor ma de drugs ko de na ade sam ni bagan nam anaigen ba yede mandirang ni dau biji sugar ba drugs ra ba waba ongaya mangani kon muksungaya andi ba ya chapter ro de drugs ne aga no de ba ko muksung batana wa mandirang ni injection ba mandirang ni wa dendrite rangko smilk pa ukosa drugs ne muksongane medicines ara me samrangmo paracetamol azithromycin yarang aro painkiller rang and self medication ar self medication means de na anthangan doctor ongjagen chimo ba na anthangan sko sa takinga no de anthangan paracetamol ranga taya deki mang jak sa takinga no de painkiller ranga taya mo na anthangan doctor taka ukosa self medication ne manga self medication de namma namjamo self medication is not good hai daude drugs and medicines mo anching iko namme nyangs khana mai mancha drugs mai mancha medicines. A drug is a chemical or non-infectious biological substance which alters the body and its functions. Daude mai dakana drugs de chemical ge sa ongane chemical ge sa jian infectious by infection ongacha non-infectious ongamo daure yaramai takana anchingni ben ni functions rangko change kana gata matna mai kai change ka warang anching niang genne. Most drugs are used in diagnosis or treatment of diseases and to relieve pain and discomfort nibo angni da siagan ni gata drugs ne aga no ba sam ko ba muksungaya basko de wa dendrite injection mandirang ni raga ba u ko ba muksungaya di ba anching de jen salo mandirang ni gaman khna wadi drugs rangana drugs ana unode bako muksunga chingara one bg aro mayana dendrite rangko jakhal bako muksunga mo endi oba yano bisungni agana ne gata most drugs are used in diagnosis or treatment of diseases and to relieve pain and discomfort daudi mai ko agani ana drugs rangko mai ni gaman jakhala na suppose na jak sa de kenchunga mo de pain killer rangko rangatna na ba mo aro ba mai ba sa dengan yang dong bichunga mo de uko namatna gata drugs ko jakhala uko muksongi ngai no ne. There are various sources from which drugs are obtained such as plants, animals and minerals. Some drugs are synthesized in laboratories. Daude mai ko muksonga na daude drugs ko de kapan biya prangoni ba bostu rangoni ko bukotna gata matna daude drugs rang ko de plants rang ni ko manai dau nasimang means na amasya chiksam rang ko masya mo chiksam sama chek yarang ko de ojarang ni thari ba yarang mai ni ko thari batta plants rang ni ko thari batta mo digimang animals daude matpurung rang ni beagle ba greng yarang jiba sam ko thari abamo uko muksonga minerals daude phosphorus calcium ya minerals rang ko jakhale ba sam rang ko thari na gata mana aro badia ba sam rang ko de laboratory mancha on tharia ne agana. As medical science progressed, the need for more and more drug was felt. This gave birth to era of synthetic drugs. Daude matakana mandirang panga hamo jela ha takple population anching Indian number 1 nge ha population explosion of 140 crores plus people dongamo mande rang anching ni India o donga andita banga agal sakmo number 1 wa anching ni Indian mande bangbat kepa daude mande bangode mai ko nangen mande bangode dongsak na ba biap nangen chana na ba nangen sam rang ko ba nangen mo so tungo sam rang ko jakhal na ba nangen uni gaman mande banga ni gaman sam rang ni demand banga ni gaman daude me takana synthetic ba artificial drugs rang ko ba tharina gata aba chenga hamo hai daude. First pioneering work in the field of synthetic drug was done by Paul Ehrlich 1854 to 1915. He laid the foundation for chemotherapy, that's treatment of disease by administering chemicals. Daude sawa synthetic drug ko thari chenga hana Paul Ehrlich sa synthetic drugs ko thari chenga pa ong ahane daude biara badia drug ko thari na chemotherapy daude na smang khna gen je mandinan cancer matna ba mo o chemo ninga we amkha ko ba chemo ninga takba khna ga honba wara mayana one chemotherapy daude mandirang de stylish ong anigam disung chemotherapy ne agana scha direct chemo ne sa shortcut sa agana tayane chemotherapy ko sa muksonga. The next step in the history of development of drugs was the discovery of penicillin by Alexander Fleming in 1928 and streptomycin in 1943 by Salman A. Waxman. Daude sam mangani ni gaman agan dap khoinga penicillin ma sha bomo anching penicillin ko jakhala daude penicillin ko saw discover kha ana Alexander Fleming discover kha ne mai bilsiona rikcha chisku kholgr chetto aro streptomycin kora sawa discover ka na cellman a worksman manggapa discover ka mai bilsio research isku sotbri kathamo ne. Though we have plenty of drugs available in the market, these drugs should be taken only under medical advice. Tao de andita drugs rang andita samrang banggen chum ong ba mai takana anching de doctor ni advice prescription dongo sa sam ko de bre rengna gata nang antang thang doctor dakna gata nangja. In case of an illness, you must go to a qualified physician and you ensure that the doctor holds a recognized relevant degree or diploma. Tao de jen salona a sa denginga mo uni salona a qualify ong ba doctor chiri yang bo MBBS doctor chiri yang bo ne dige rempa chempa chiri yang na be hai dau de proper use of drugs mai da ki anching namme cry samrang ko chakhalna gata ma again. Drugs have to be handled with great care. They are capable of doing a great deal of good, but it is if used indiscriminately they are capable of doing great harm to. Dau de sam Quran sing mani gimen rengana sa denga ko namat na sa andi ba sa denga ni ko namat na bate namat chana ba maknaya ya samrang de uni gimen sing jen salo samrang ko chakhala namme krai chakhalna gata nanga. The harm can be temporary and minor or a kind of permanent disability or even death in some cases. Tao de ya sam ko kra gijar ngode unode mande sabat na ba donga mande sisang na ba donga ne uni gimen sumsake chakhalna gata nanga ba mukron rang nakchana dong nasal khna jana ba donga samrang ko krai jakhal jaude. The drugs used can be non-prescription or patent drugs or prescription drugs prescribed by medical practitioners. Daude mandirang ni jakhal gapa self medication de mayana na pharmacy chiri angimang angna painkiller isa strip sa unat pon gapa yan maina yan self medication ne non-prescription prescription green ara aya aru gi sa type para maina prescription gannang isa manaya mo. Non-prescription drugs are generally used in case of minor ailments such as headache, common cold and pain. Taude naa paracetamol gi sa disprin gi sa ranar yang ode maiba kon angiyama prescription kon angiyama ra angja antangan ra bayamo sko sani samko nat buda soldi matninga samo nat buda ben sa de kinga samo nat buda take biaya bamo yan non prescription. Taude one should follow the direction on the levels carefully, and if the symptoms of the ailment persist, the physician should be consulted immediately. Taude me dakana naa suppose gushu ni samkor aba hamo gushu inga gushu ani samkor aba jok taude uko mi chani jamano chamuskini dike changgatham rengna nangen sallo ne akana ta endi ban a botol sa ko grok ngat chok no de wara namgin ma namjawa batte sa nangni sade bakno na chisat kono na sabat na ba dongamo ni ban namja. In case of prescription drug, the direction given by the doctor should be carefully followed. Taude jen salo na doctor ni onata ko prescription baksar aya ha unde doctor siabamo mi chanas khang mi chani jamano wa de rana gata nanga. The leftover drug should not be used without consulting a doctor. Taude sabarang de some extra dongo de gacha jokode ukhud dunai jamano saude ukhurang thai gen diban dike takna nang jana ne. Drugs should be purchased from reputed drug stores. Taude jen salo na samrang ko rainga no de some expert ongpa pharmacist namgpa rang ni kusara borempa chempani ko rana bene. Spurious and adulterate drugs can even cause death. Taude suppose mandirang de dak play poka nigam disong mai takana expire ong barang ko ba phalna gata matnaya biscuit chocolate yarang dan sa salanti na kay expire ko phalai mon dibe expire ko phalo illegal ongane police sunna gata matnaya sam khode mamang salba guwal leba expire ko phalna gata nangja mai na ba expire sam ko phaljo na ba date rang ko namme check khagi jara bajok jamane rengjok no de bas kamagonok changi gamani ba oyane. Spurious and other or like the expiry date of the drug should be considered while purchasing or consuming a drug. Unigaman jen salo na some extra dung pa ko ba bazalo ni ko pre banga je ko ba dakinga na date ko niye sa rabo manufacturing date ko niye sa rabo baita balsi ba baita ja choli ko gen uko niye sa rabo. Leftover drugs can be donated to charitable dispensary and hospital. Taude na suppose sam bangkhal le raba jo uko de na charity dake unatna mana again dispensary na ona ka kon ba mo father rangni sister rangni dispensary rang kon ka hon ba warango donation dake unatna ba mana ya maina ba sister rang de mena kana bisong de nurse rang donga ba mo bisong ma si ba ga ba sam namma ba ga ba namja bisong ra chak cho namma di bisong ra chak again mo. Self medication taude andang tang sanna banani. You have learned by now that different drugs are used for different purposes. You can obtain some drugs from the chemist without the doctor's prescription. Others can only be purchased if you have a prescription from a qualified doctor. Sale of drug is governed by the Drugs Control Act. Every drug is potentially dangerous. Improper use of These may lead to serious consequences. Tadi mana pana? Badia ba drugs ba badia ba samrang ko de na doctor ni prescription griba brena kata maknaya. Hindi ba badia ba samrang na de doctor ni prescription ko nang chomot wa dongjaw ne nakna wa sam ko onjaw ne. Aur sawa ya drug ni control drug sell and purchase ko control ka Drugs Control Act ne. Degi mengde gemek samrangan danger ba ngaya namba namaya ne namme jakhalo de namma namme jakhal jaw de namja. You may ask, why should I go to a doctor for a simple headache, toothache, high fever, or sore throat? Tao din na chanchina ba dong are? Anga waga makmak sa de kaya ba anga gutok makmak sa de kaya nga ba anga fever on thi fever makmak na be endeng nga ba anga sko sa de nga una makmak ma na doctor chiri gno ne na chanchina ba dong amo tao de. Why should I not buy the patent medicines and over-the-counter medications and cure myself? Tao din na chanchigen. Hari angara wa paracetamol rongsar ay anthangan rangat na matnay ngende una makma doktor siri na nanggen ma wagam satakingan over painkiller rangat na matnay ngende amakhani dokhanon dongade ane chanchia ba mo. These questions are very relevant. Two important reasons for using drugs without doctor's advice are lack of resources or lack of attitude. Tao de naa maini gaman doctor ni prescription gri samra aingana reason gi gini dunga kesara naa nangni because of nangni attitude ni asel ba resources chungja mo. In our country, the desirable practice of regular medical checkup is still not practiced. Tao de mana kana mandirang de janti checkup ka ba jado ko changsa ba bilsi sao changsa de ke checkup ka ama gupan country rang oden de ba India ode de ke dakcha. Therefore, we often use medicines and try to cure minor ailments ourselves. Unigman changmai ta kana routine checkup ba regular checkup kha jaima anchingde chonchon gapa sabi chirang da andang thanga namat nakta joton kha mo. Tao this type of self medication is dangerous, long and danger on ide. In fact, when self medication is prolonged, it can affect one's health seriously. Tao na suppose fever matnenga mo. Tao fever mat mutengon na de onthi fever mat mutengon doctor ko grong na kata manga maina no ba na anga dal checkup ja khnalo namai ganok de Tema khnalo nama aro sal ko pono sathai jo tema aro nama de wal jatchio sa ha belong ha serious ong ha deke dakani chance tongani gaman on thi sao ban sana mesokna na doctor na mesokna na ong jade danger ong ane. In fact, when self medication is prolonged, it can affect one's health seriously. Symptoms like chest pain, blackout, nausea, and unconsciousness may need immediate medical care by a qualified doctor. Daude na khathong sa takinga na ba na weak feel khainga anemic feel khainga mo ba gisep nombo kaya shibo kaya no de na tharaken doctor ko grona kata nanga. How do we know when to consult a doctor? Tegi manchuk bas ko mai de ki masya tau ya sabisna anga doctor ko consult khana nangin ba angni sahaya serious ong ha dau de anga doctor ko grona nangin mai de ki masigen na. Severity, persistence, and repetition of symptoms should be used as criteria for consulting a doctor. Also, when you are in doubt about these, a doctor must be consulted. Tau de bangkhali serious ong ha no de doctor chir yang thelaibo je gata chelo ba je gata dam rakko ba yang aibo ne. Dangers of self medication tau de na thang samna banani ko dako de mai ongen. Self medication may be dangerous or even fatal. Tau de na thang ko self medicate khao de wara mai dakana dangerous bangai ba mande ko sot na gata ba manaya. Listed below are some of the reasons why medicines should not be used without consulting a doctor. Tau de mai ni gaman aching doctor ko consult khagija samrang ko chakhalna nangjana hainina. Similar symptoms may arise for a variety of diseases, both fatal and non-fatal. Without knowing the cause of disease, it is dangerous to treat it on your own. For example, painkillers may relieve pain for some time, but the disease which has caused this pain may progress without your knowledge. Example, suppose na khathong sadaka daudin ade rengenga samrangai painkiller da aldin amaha knalba namaha bun salba namaha and then next week na khathong sadak thaya ha daude unoba na samrangi man nampla ha tegimang bilsi sa na samrangi man nampla ha andi oba last to masigen de khathong sadak chacham ya angni liver sa sadakinga chumba je bamo uni gaman anchinde ignore khana gata nangja je problem ongwa thara khale action ko rana gata nangamo. Reaction to various drugs differ from individual to individual and for the same individual under different conditions. Daude badia samde nangna namgen angna namjawa badia samde angna namgen nangna namjawa ni gaman nangni be ni nangna kanrang dengthang angni be ni nangna kanrang dengthang. Medicines prescribed for another person for the same disease may not suit you, even if the symptoms are similar. Some individuals are allergic to certain drugs. For example, the antibiotic penicillin is known to cause serious allergies in some individuals. If you take penicillin without the doctor's prescription, it can be fatal. Maiba samrangde nakni beena namjana badonga. Anching sau barangde allergy donga bamo allergy wak chana manja ba do chana manja ba miching chana manja ba tha chana manja mo maina ben khaktaya. Wanda ke samban dakaya. Badia ba samrangde sana bade suit kha jawa umude allergy rako mangen. Wanda ke ya penicillin samni example ko na habisong penicillin samrangde sana barangde namjana. Bisong katani ko mana allergy o ne mara hero ma yarangde hero ongja yarangde zero sa maini man zero drug addict rang sa yarangde ne. A number of medicines have side effects, that is they may relieve the symptoms but may cause other problems. For example, some oral antibiotic may cause vomiting. Yes, tawde mana kana bangbata samrangan side effect tonga uni gaman paracetamol rang ko ba salan ti de rang na be painkiller rang ko de rang sang na be ne namja plongin namja mana lupa wa painkiller nangni wagam sa ko dau namat na badongan diba jamano nangni wagam go ok sang na badonga ningman doktor ko meso emang check up kaun best ong bataya ne aro badia ba samrang de mai nakana nakho chi satat na ba mana ne. Using leftover medicines from earlier illness is also dangerous taude. Suppose nangni jonggupa sainga chumba mo nangni jonggupa sa digemang fever mana chum digim biya nama ha biya nami mang dalde na sas kain jongna de nangni jonggupani samko na runga takna bemo namja. Dosage of medicines taken without consulting a doctor can be very harmful taude. Je samko na doctor ko consult kagija ringinga ode blongen danger ne. All drugs are generally pre-tested before they are recommended for general use. Kamak samkon bisong test ka chenga test ka ni jakmanusa public na de o prakamo. But sometimes even pre-tested drug may cause harm to some individuals. Unigman taude manakana test kagaman samrang ba baskoba de sana barang de namjana ba tonga. But sometimes thalidomide, a drug used to induce sleep, is one such example. Pregnant mothers who use this drug during pregnancy gave birth to deformed babies taude maidakana thalidomide ara samge sana ya sam ko de maidakana thusina kata chakhala sau barang de maiba tonga ba mo mai nga sum saubarang de insomnia donga. Insomnia ramana inability to sleep means de na waloba thuna skcha daude na mobile khalima walo thuna skcha ba insta khale ba reels niye thuna skcha ukhomuk songjane yano de na walo thuna manjano de na sainga na insomnia manenga te kyomani unigaman walo ansung mobile rangko ba agre play chakhala namja git rangko ba earphone tekke thuna gata nangja aro Instagram, Facebook, Reels yang ko agre play ni nagata nangja. Ong jadi insomnia ko maknanya. Insomnia ramayana na walo thuna manja. Ne upo insomnia ne mga. Hai daude using digi mangde yano example ki sa ko mesukni o example ramayana sau ba me chukmarang je rangan pregnant chong achem bisongara ya thalidomide samko chakhala unura mai ko makna hana mai wana bisa chiro mai wana bisoni bisa de namme ben bimang ongkuja ba abnormal bisarang acha ba handicap bisarang acha mo. Drug abuse ni orthora me abuse ni ortho de namgija jakhalani ba kragija jakhalani mo abuse. There are substances other than common drugs which have potential for abuse. They range from kitchen spices made from common flowers and weeds to highly sophisticated drugs. Daude samna agreba maiba bosturang donga jerangan blongen nangni health na namja. Aro ya bosturang ko na nangni kitchen no mosla donga parangoba matnaigen ba nangni sara o phul ge ga parangoba matnaigen ba burung rangoba matnaigen. Drugs are inert substances, neither good nor bad in themselves. It is the nature of human involvement, how and under what circumstances they are used, which makes them either beneficial or harmful. Daude someday namma ni baga namanja sam ko de namja ni baga namanja na name jakhalo de namma na name jakhal jao de namja ne. Drug abuse is defined as self-administration of drugs in excessive or inappropriate doses. drug abuse ni orthora mayana na samko ba drugs ko namme jakhalja khra gata jakhalja suppose gushwani samko nangna salo changtham rengbo chamuskni dakini aga nandi ba nade botol sakon ranga chok wade drug abuse ongskha ne. The drugs that are likely to be abused may be classified into 4 categories according to their function. That is, now the drugs ko rokombri deke classify ka awarang ramena. Number 1, narcotics. Gini para depressant, gatham para stimulants, bri para hallucinogens mo. Narcotics, depressants, stimulants, hallucinogens ne. Alcohol and tobacco are 2 other substances most commonly abused throughout the world. Now the chew ko den noktango, songtango, community o gama ko nakapa mo, biri rungga parang ko nakamo, cigarette rungga parang ko nakka, gui sada biri rungga parang ko nakka kon pamo, ya rangan namgija drugs take ong mo. Ya rang de blongin namja may na ba chu rungi meng noktang ko kolmal kaasan ong aya. Sada biri rungi antang na losan ong aya. Je madyan sada biri runga wara may takana, bini lungs de nostong gen aro je mandian chu runga wara mai takenna bini liver de chamang again kasen ne ai daude. Narcotics, depressants, mild sedatives, barbiturates and tranquilizers and stimulants are essential to the practice of modern medicine, but hallucinogens are used only in medical research. Daude narcotics but depressant aro stimulant ya gigatham ko de practice khaya na ne samrango chakhalaya andi oba hallucinogen ko de chakhalja ukura research na mama chakhalaya. When administered without medical supervision, they are said to be abused. Daude ya drugs tangko narcotics, depressants, stimulants tangkora doctor ni advice kri chakhalna gata nangja. All substances with the abuse potential can produce changes in human behavior, particularly when large amounts are improperly used. Daude ya drugs tang ba samrango me takana na bangkhali renga chokno de nangni be na blongin namjawa. The abuser may feel intoxicated, relaxed, withdrawn, and solitary, or sociable and talkative, quick to agree or believe. Daudin achimang nakka je mandirang churunga bisongde jada boda de ke behave ka abamo one de ke drugs chakal ke paban da kai saubarang de blongin gol phogen saubarang de grab gen saubarang de khadeng gen saubarang de banu ba nala rango napero gen saubarang de banu ba dolong khama rango thuwe donggen ga ake donggen mo machi warangan drug abuse khaba barang. These changes may either be harmless or may pose a serious threat to both the abuser of the drug and the society. 1, daw de drugs chakhale meng khore maha phagla maha nu de wara songsul noksul naba namja ba mo 1 wa mande naba namja aro songsul noksul naba namja. Daw de narcotics, they produce sleep or drowsiness and numbing effect on consciousness. Narcotics also reduce body activity and reduce relaxation. Daw de narcotic drug karamai takana mandeko thusiat na kata matna mandeko nomat na kata matna. Narcotics drugs mai takana ro body ni activity rangko khasan nata mo. Some narcotics are used by physicians and dentists to relieve or prevent pain. Daw de sauba wagam okna menga nu de direct wagam okka thode namgen ba namjoba unigman painkiller ko suchenga ba mo ya painkiller ran narcotics mo nangni sa dagani ko khomiat ken sagoba operation khainga surgery khainga no ba painkiller injection ko shuwa ba samrang ko na ba mo 1 narcotics ne. Codeine is an important component of commonly available cough syrup. Nivo ska ode ya codeine ko de doctor ni prescription gride on ja chmaina ba manderang chu nipal ya maiba kusa ba drugs nipal ya shuni samko renge bisongara drug abuse kha mo diba daude ska ode ya codeine ko ja chim dikim dauba doctor prescription gride ko de manja mo. Novocaine is used by dentist for local anesthesia. Daude mai dakana novocaine mangapa drugs ko dentist rang chakhala ne anesthesia unna before filling or extracting teeth. Daude jen salona wagam tharina rianga ha ununa nakken Dr. BG Sugen wa BGon novocaine ba novocaine ko chakhala ne. Daude morphine is also used to smoother unbearable and severe pain. Narcotics can be fatal if not used under medical supervision. Some of these are known to cause addiction. Daude morphine mangapa ba blongen namana sauban jab ya jak pi ya plus taking ama uno ya samrang ko chakhala ne andi ba yarang ko pangiran chokol siya ya mande ne. These drugs affect the central nervous system, reduce functional body activity, and produce muscular relaxation. Daude depressant mungkababa mandeko khasin nakta. Yara mai takana central nervous system ko affect ka. Unigaman wa mande thom thom me khasin nimche be aram se dongna kata manane. Depressant is prescribed to the patient because they give a soothing feeling and reduce body anxiety and tension. Daude je mandirang phaglarang wabamo bisungna ye depressant ko onna je dakode wa mande thom thom donggen ongjade jen salo mandirang phagla ong hamo ono thom thom dongjabamo ye chiuji halla gulla taka ba ono bisungna ya biji ko swacho thom thom thuwe dongai gnokne. If taken in large doses, it can lead to artificial sleep, then to coma, and finally to full stop. Taude yes ya depression ko mai takana pangne jakhal chokode mandir thuai gno pangkhal le thuai gno uni jamanude wa mandira khoma no sukang gno uni jamanude wa mandiuna khoma uni full stop na sukang sukang, which means siai gno ne agripli ya depression rangko jakhalo den dakaya. Bromide are also depressant and should not be used without consulting a qualified physician because they are intoxicating and poisonous. Taude bromide mungkapaba sam ki sawa jeko doctor ni advice kri jakhalna gata nangja maina biya addictive ong aro longen intoxicating one. Barbiturates, another category of depressant, are generally present in many patent sedative or sleeping pills. Taude mandirang sleeping pills rangko jakhala jerangan insomnia donga walu thuna manjamo unor mai dongana barbiturates mungkapa sam dongane. So indiscriminate use of these drugs should be avoided, otherwise it may be extremely dangerous. Some of these drugs and alcohol can give rise to addiction. Addiction ong addict ong amo unigiman ya thuani samrang ko jakhalna kata nangja. Stimulant taude stimulants increase activity of the central nervous system. These drugs produce excitement and decrease the desire for sleep. Taude mai takana central nervous system ko affect ka stimulant samde ba drug dene era mai takana mande ko excite ong atna matna khushi ong atna matna mo mande thuna skin chung ode thuna skat chana ka taba matna ya. They also cause loss of appetite. Taude okriya ba okrija stimulant rangko rngode mande okrija. Appetite means the okriya ni ba okrija ni ne. The apparent effect is the increased activity for a short time by using the reserve stored energy. Taude mai takana amthangni bulko chakhalna gata matna ya samko rngode ne. Then there is a sudden decline of activity. As a result, the victim needs more and more stimulant. Taude mai takana dao sauba stimulant ranjok no de pede balak kai gano ha ita chlana ade ang chlate truck saba chlate tractor ki saba chlate bas no problem diba bia adha hanta kham khani jamanun aro nanggono aro na na thai bojo ngai gano aro chlai gano aro nak na gano tike penis kani bari rorwana ne. Some stimulants such as amphetamines are used medically to combat depression. In psychiatric cases, these too can cause addiction. Taude bano varangde soba psychological disorder rang dongode wa mantena amphetamine dakwa samko onna mo depression ko pa mante soba de depression ya stress ya wa mantena na ya samrang ko onna. Hallucinogen. The name of hallucinogen itself explains its main effect. This results in illusion and hallucination. An illusion is the distorted image of the object seen. The abuser cannot distinguish between a fact and a fantasy. During hallucination, a person sees images that do not exist. These drugs affect one's mental and visual perception. These illusions lead to antisocial behavior such as stealing, violence, and ultimately it may result in fatal accidents. Taude hallucinogen means the je bostu an reality o dongja wa bostu dongjan diba wa mande de nakna gata manaya. Means they memang ba dongja ba mon diba mande nante memang ko ba nakaya ba one the ke hallucinogen means they je bostu dongja gen chmoba na au ko wa gata nakken basa ko ba de ongija ko ba bostu rang ko nakaya anga memang ko nakchok anga mai ba ko nakchok. Illusion means the ongija agatalo ongija ko ba bostu ko ba obosta ko nakpa ko ne nga ya ta ko ba mande nante blongen violent nga namja dege mong chawaya ne. The use of drug does not help an individual to solve his problem. On the contrary, it can cause irreparable damages to an individual's personality and can be life-threatening too. Therefore, it is advisable to abstain from the misuse of such drugs. The youth is at a greater risk of getting addicted to these drugs. Therefore, generating adequate awareness regarding the issue is essential. Daude ya hallucinogen ko mandirang jakhalote mai dakana wa mandeni sa dengani de gamajo batte sa wa mandera mai dakane edi kongs khagenne aru society na ba namjo bina ba namjo. Tobacco ko de anjing makan masia banu matna sada birio matna. Tobacco is obtained from a nicotine rich leaves of a plant which is grown in many parts of the world. The leaves are dried and cured to produce tobacco, which is used in preparation of cigars, cigarettes, BDs, and other similar products. It is also used for chewing purposes. Some people use it as a snuff in the powder form. The smoke of cigarette and other products of tobacco give out carbon dioxide, carbon monoxide, and numerous tar-like chemicals and are extremely harmful as they are cancer-causing substances. Daude biri renggepa, sada renggepa, cigarette renggepa ya rangaramai takana cancer maknanya. Mainaba ya bisong jen salo biri rang inga ha aro cigarette rang kurang ha walku abamo walku ramai dongana carbon dioxide donga carbon monoxide donga ne bani gaman na anakni sepang ba soba biri rang ba cigarette rang no de bengbo wa mande ko angni khango de kerang na be gari rang de beng sangai bo gari rang de rangani information dongja allow ongja gari de no smoking sia sina rangna manja hospital lo school lo rangna manja endi oba dokan rang ba na a beng ai bo mainaba ude binaba harmful ongen aro na bini mukhango chadeng emang na ba smell gepeng aba mo unude nangni lungs ko ba affect khagen. Nicotine and other chemical enters the body through the nose, throat, and lungs. Nicotine causes dizziness, headache, and may affect blood circulation, respiration, and digestion. Heavy smoking increases the rate of heartbeat and causes palpitation. Smoking is also associated with cancer of lips and larynx, chronic bronchitis, lung cancer, and peptide ulcer. Young people, therefore, should be sensitized to the life-threatening harmful effect of smoking and chewing tobacco in any form. Unigaman, ansung youth rangko educate kana gatananga, mainaba, ya tobacco rangko nicotine rangko jakhalude, mandirangna namja, mandirangna sadeng tang cancer rangko mangen lung cancer, throat cancer, dao na biri packetsa ba cigarette packetsa ni bikro ko nibo, smoking kills, but smoking causes cancer takwa ko nakenne. Alcohol ramena chew. Alcohol is a fermented organic liquid obtained by the natural fermentation of malts and sugars. It is the intoxicating constituent of wine, beer, spirits, and other alcoholic drinks. The alcohol used for drinking is ethanol or ethyl alcohol. Daude mai takana chu. Beer ongbo, rum ongbo, vodka ongbo, whiskey ongbo mo yagamakan mayana, wine ongbo yagamakan chu samo. Chu ara namama namja. Aro anchingni mandirangni renggapa chura mai dongana ethanol menggapa sa dongska ane ethanol ko sa renga mandirang de endiba pure ethanol ko de renga manja pure ethanol ko rengode shisang aigen mandirang ne. People also sometimes use alcohol such as methyl alcohol and isopropyl alcohol basu ko bade methyl alcohol ko ba rengaya mandirang aro isopropyl ko ba rengaya. Methyl alcohol is toxic as it is deadly poisonous, causes blindness and even death. Tawde mai lakana methyl alcohol ko mandirang rengode mai wana siaya ba basu ko bade mukron nakcha Ghana. It is unfit for human consumption. Isopropyl alcohol is widely used as a solvent and cleaning agent. Daude isopropyl alcohol kura banu jakhalana wa color rang no krango color rang khaude gate rango gari rango color khaude uno jakhalane. Alcohol when taken in small quantities cause intoxication. The heart beats more slowly and the muscle of the body vessels relax, causing the skin to flush. If the consumption is high and continued for a longer period, speech becomes indistinct, there is a loss of balance and finally reaches a stage where one cannot see clearly and falls asleep. Bangi chun ko para mai takana jio ba ga ki dongai nala ba ga ka again saro ba ga ka again mo aruwa mandira khusba ganna manjawa chagatna ba manjawa. Excessive drinking causes unconsciousness. Daude bas ko bade agre ple churung ahanu de wa mande de shibo kai grok ba nombo kai grok last to de siaba sisanga ne agre ple churung ko parang de. Alcoholism generally leads to addiction because of its effect as a depressant. Daude alcohol ko ba depressant dike jakhala jian addictive means the daalo na churung jokno de khnalo barang scan khnalo barang jokno de amun sal barang scan dike man khasin sin na de salanti chukor nagta sky gnok ne. The person who drinks in an uncontrolled manner is called an alcoholic. Sawa alcoholic chu ringna nalgapa ho alcoholic ne mga jian salo baranggen frungo baranggen athamo baranggen wallo baranggen frungo baranggen mo watakpa ko alcoholic ne modaru mo ansinde modaru ni agana ba one modaru ko alcoholic ne mga he becomes a slave to alcohol wa modaru rame dakana maibani nokholonga chuni nokholonga maina ba chu gri one modaru de jangi thangna kata manjawa. The following saying clearly establishes the consequences of alcohol addiction. First, the man takes the drink. This quotation gets us here. Skang pade mande churungen. Then the drink takes the drink. Gni pade chuan chu ko rengska gono aro githam gpaude then the drink takes the man githam gpaude me lakana wa chuan mande ko rengskaya which means saubas khango root saubas khango step number 1 o chu rengchengen tegimang gni gpau edik ongono githam gpaude wa chuan wa mande ko so tai gono ba siai gono ma mande chu rengthengen modaru umthengen mo hai daude addiction to alcohol starts from drinking occasionally to moderate drinking and then heavy drinking the individual thus becomes completely dependent on alcohol daude chur ngani de takana addictive onga which means sombalo rengjok na de mongolbar bar nas kono gotok dry amgen gotok ranenga mo chur ngatna nanggen ba yan tirengjok next week bar nas kono aru uni next week bar nas kono wandeke ta alu rengjok nalu rengjok amban salu rengjok deken addiction addict last to dene uni gaman chu biri sada yarang mamun salu nagata nangja ya video de yarang san kono